So thank you, Max. Thank you, G4. Thank you, Bayer. We really appreciate the opportunity to come and present here. So Blackford is a platform that allows the integration of AI into medical imaging. Now, I'm sure that all of you have heard about the tremendous advances of AI in medical imaging. You hear about all sorts of things in the trade press. You hear about things in the national newspapers. You see it on websites. But in fact, the reality is that hardly any of this has reached the patient. And the reason for that is that any kind of IT product that you want to deploy into a hospital has a phenomenal cost associated with it. I'm not talking about the purchase price of that algorithm. I'm talking about the committee that needs to approve its deployal, the team that needs to work together to solve the radiology IT issues, the hospital IT issues, procurement, legal. It just goes on. So what we do is provide a platform that allows all of these different applications to be delivered in a turnkey way. So you can see a selection of our suppliers on the left there, and some of the hospitals that we serve on the right. So if you are a hospital and you want to try an AI application, rather than having to work for 18 months to try and get this deployed within your system, if you've got the Blackford platform there, you switch it on, you try it. You see whether it works for your radiologists, for your case mix, crucially, for your referrers and your patients. And if it works, you keep it, and if it doesn't, you move on. If you're looking at it from the side of the application vendors, you need to think about the cost of acquiring a customer. It's something like $30,000 per customer that you acquire in the US. And that makes developing any kind of AI product and actually releasing it to market phenomenally expensive. So we've got a two-sided marketplace here, and Blackford sits in the middle. So it's a great idea, but the question would be, well, how real is it? Well, the Blackford platform is already deployed and running with clinical applications in 356 imaging centers, 229 hospitals, and that's across the US, Australia, and New Zealand. We also use our product as a white label piece for Nikon in ophthalmology. So we're deployed in well over 700 ophthalmology clinics worldwide. And we're absolutely delighted to have reached the milestone where we now treat, or we now process more than 1 million radiology patients per year. So thank you again for the opportunity, and I look forward to talking to anybody at our booth just over there. Thank you.